They carry you where you want to go. They stabilize you nearly every moment of the day. You need to have healthy legs to have an active, pain-free life, but underlying conditions like deep vein thrombosis can make that impossible. Dr. Zoe Deol from the Center for Vein Restoration is here to explain. We also have Carol Sarnes with us. She's a patient. Good morning. Thanks for being here today, ladies. Appreciate it.
Thank you.
So first of all, we're talking about this today in particular because March is the awareness month for this condition, correct?
That is correct. Okay. So March is DVT Awareness Month. DVT stands for Deep Vein Thrombosis, which is a clot, usually in a vein in the leg.
Okay.
And it happens in 1 in 20 people in their lifetime, and a third of those people, the clot will break off and go to their lungs. So this is a very scary, deadly condition.
Wow. Okay. So tell me a little bit about your experience with this. Did you have any symptoms? How are you feeling?
Well, I took a trip to Florida, and the only symptom I can tell you is that it was kind of like a Charlie horse feeling.
Okay.
And when I came back, I was scheduled to do a procedure with Dr. Deol, and that's when she found the blood clot in my leg.
Wow.
Yeah, so hers was an atypical case. Usually people with blood clots, there are risk factors such as surgeries, cancers, immobility, smoking. For her, she really didn't have very many symptoms, but her risk was the long flight and her immobility on the flight, a long car ride, a long plane ride.
Wow.
And her vacation, she was less mobile than she normally is.
Okay, so not getting those daily walks out and getting outside, and we were sitting back and relaxing, right?
Well, I would walk the beach every day, but apparently it wasn't enough.
It wasn't enough. So what can you do to treat something like this?
Okay, so for her, we happened to find the scan, or find her clot on the scan, and most people that had DVTs in their family, they remember the medications such as Coumadin or warfarin, which required weekly blood draws, and they had to have a restricted diet. But now we have new medications that don't require any blood draws and no restrictions in their diet. And how did that medication make you feel?
Well, I took Eliquis, and I had no symptoms from taking the drug at all. They do tell you take it with, eat something while you take it. You could have bleeding or bruising, and I didn't have any of those symptoms at all.
It's possible for some people, obviously, to have some of this, but for you, you feel great? You feel good?
I do. It took 14 months before I finally was able to dissolve this and get on with my treatment.
It's serious, though,
It is
and that's why you really need to get in, and if you're not feeling right, and what should people really be looking for when they come in?
Good question. So even though her symptoms were very mild, most people, when they develop a DVT, they get sudden swelling in their leg, redness, and pain. Any signs that the clot has gone to your lung, it'll be quick chest pain, shortness of breath. And it can happen in the healthiest people, even though I mentioned risk factors. People like Serena Williams, tennis player.
I saw that. I was surprised by that.
Yeah, so she had a DVT, and nobody is immune from it. And like I said, it is more common. 1 in 20 people in their life are going to develop DVT. And so the things you should do to prevent, even though Carol did that, she was wearing her compression stockings on the plane. Try to stay hydrated if you're on a long flight. Try to do the exercises where you point your toe, flex your ankle to keep your calf pump moving, and just get up and down. And I know this is going to affect a lot of people, but don't drink on the airplane. Wait till you get to your destination.
That's the only way I
know, but it will dehydrate you, and it also makes you more immobile. So
we have to think about
these we do.
Yeah. So people want to come in. Maybe they want to book an appointment with you if they've got some things they want you to look at. You have a couple of clinics nearby, right?
I do. I have a clinic in Oregon, Ohio, here at Mercy St. Charles. I've got another one in Southgate, Michigan. We have clinics nationwide, and we have a DVT program that we can get you in there immediately. So if you have family members that you're concerned about, they can just call my number here, and they will even get a clinic in Maryland or New York or New Jersey. Correct. And I'm also doing a lymphedema awareness event at Mercy Perrysburg Cancer Center on April 8th. So I will be at the Cancer Center, and I'll be offering free screenings.
Oh, wonderful.
Yes.
So that's a good opportunity there as well. Well, I'm glad you're feeling better and getting that treatment, and it's working out well for you. Thanks for coming in today. We appreciate it.
Thank you for having us.
Absolutely. Well, how you can avoid an unpleasant surprise and make sure you get a better tax return. That's next.